So in a moment, we are going to get into what to do, the to-dos, the behavioral to-dos and some of the other to-dos for trying to keep your mouth in the best possible remineralization state, the best pH for tooth health, for gum health, for avoiding periodontal disease, maybe even for reversing some aspects of tooth and periodontal sickness. Because indeed, you can do that if you shift your mouth to the correct pH, if you're putting it into that remineralization mode, okay? However, before we get into the to-dos, I think it's very important to discuss the do-nots that every dentist and periodontist I spoke to agreed on. The quick list, as I'll call it, of bad for your teeth, bad for your mouth, and therefore bad for your brain and body are, not surprisingly perhaps, alcohol. I'm not here to tell you to never drink if you're an adult who's non-alcoholic, but the cutoff seems to be 2 alcohol-based drinks per week, beyond which you run into trouble. And yes, 0 is better than any. But here, when we say alcohol is not good for oral health and for tooth health, what we're talking about is the disruption that alcohol creates to the microbiome and the way that it alters the pH of your saliva and places the mouth and the teeth into a demineralization state. That's very clear. It also kills certain cells of the mouth. Some people, I remember this in college, would say, oh, if you've got a like scratch in the back of your throat, you're getting sick, you should drink. Right? And that's what they said. You should drink. It's going to kill that thing off. Well, guess what? It does the exact opposite. It kills off a bunch of things that you want, like the cells in and around the mucosal layer of the mouth that are actually going to provide immune support and eliminate those bacteria or viruses that are making you sick, etc. So the second thing on the no-fly list, or the not good for us list for sake of oral health, are stimulants. Now, of course, things like methamphetamine, which are severely deleterious, addictive drugs for all sorts of reasons. They kill dopaminergic and other brain neurons. They are highly addictive, and on and on. But also stimulants like Adderall, Vyvanse, etc. Those stimulants, basically any drug that increases epinephrine and norepinephrine, called adrenaline and noradrenaline, or the other names for those, are going to have a negative effect on oral health. Does that mean you should stop those medications if you've been prescribed them? No, it means that you should do some other things to try and offset the negative consequence of stimulants. Why would stimulants cause such disruption in oral health? Well, there are really 2 reasons. There's a chemical reason and there's a mechanical reason. The chemical reason is that stimulants change the pH of your saliva, making the mouth more acidic, which makes strep mutans and other bacteria more capable of creating cavities down into the teeth. They take your mouth and your teeth from that remineralization state, or as I've been referring to it, mode, to that demineralization, demon mode. Demon mode. That's a way to remember it's bad. Demon mode. Demon mode, not good. Maybe in a video game, demon mode is good. Demon mode, not good for the mouth. Demon mode, demineralization mode. So there's a chemical reason why stimulants disrupt the oral health milieu and cause disruption in tooth health and degradation, demin of the enamel of the teeth and deeper layers of the teeth. And this is profoundly evident in meth addicts. But the other reason, and this was a reason that was shared with me by a physician, an MD from University of California, San Francisco, who interacts by virtue of his profession with a lot of methamphetamine addicts who have terrible teeth, is that stimulants encourage mouth breathing. Watch a meth addict or watch somebody who's on a high dose of stimulants and they tend to mouth breathe because of the shifts in autonomic nervous system function. They tend to be mouth breathers. So it's the drying of the mouth that also shifts the mouth from that remineralization mode to demineralization mode. And yes, indeed, coffee, we'll talk about coffee as well, and tea will make the saliva more acidic and make your oral health potentially less good. Mouth breathing, bad for oral health, bad for teeth, bad, bad, bad. There's just no question about it. So today's discussion, I'm calling oral health, but that includes oral airway health. And I've talked before on this podcast about the fact that if you can be a nasal breather, be a nasal breather, please. As long as you're not speaking, as long as you're not eating, try and breathe through your nose. If you're exercising really hard, like you're running really hard, fine, mouth breathe. I don't think there's any evidence that staying in nasal breathing mode all the time while exercising is best for performance. In fact, to the contrary, there are times when you need to mouth breathe. And there are sports where you need to exhale through the mouth specifically, certain martial arts, for instance. That's bad. Smoking, cigarettes, and yes, also cannabis And yes, vaping does this too. Then people ask, well, what about vaping? Vaping's not as bad as smoking, right? That's what they say. Or they're sort of asking, saying, hoping, wishing, fantasizing. And the truth is that vaping is terrible for your oral health as well. Is it as bad as smoking? Probably not, but it's bad for a bunch of other reasons that offset any gain or gains you would get from vaping instead of smoking. Okay, so we've got alcohol, stimulants, smoking/vaping, and by extension, dipping tobacco, frankly, not good for oral health or tooth health. In fact, they can be procancerous to the gum tissue. It's well established. And they can also cause degradation of the gum tissue and even some of the underlying bone if you tend to do it on the same side all the time or often at all. So that's not good. We already discussed that sugar is not good for oral health. Does that mean you can never ingest sugar? No, of course not. Enjoy the sweets you enjoy every once in a while. Enjoy a nice pastry. Do as you will. If you're somebody who never eats those things, great. But then understand that any carbohydrate, any starch, provides a sugar that strep mutans can eat and create acid and demineralize your teeth, create cavities, that is. So avoid sugar in excess. And if you eat sugar, try and rinse your mouth after. And ideally, you would brush, maybe even floss after. Okay, I do know those people that after every meal, they run in, even in the middle of the day, they run to the bathroom and brush their teeth and floss. And that's great, but most people don't do that. So swishing water, rinsing your mouth out, again, plain water, maybe with a little bit of salt in it, is going to be beneficial. We'll talk about mouthwashes later, just to give you a little window into where we're headed with that. Most mouthwashes, terrible for your oral health, especially alcohol-based or antiseptic-based mouthwashes, except under certain conditions, prescribed or otherwise. Okay, so if you eat any sugar, and frankly, after you eat anything, it's a good idea to try and clear as much of that food product from your mouth. You may not think you still have food in your mouth and teeth, but try to swish some water, maybe spit it out, maybe swallow it. That's up to you. Are you a spit or swallow? Not my business. Don't want to know. Don't tell me. Don't put it in the comments. Just decide for you. But sugar and other food products residing in the mouth for long periods of time, not good. And similarly, acidity. Foods that are acidic. So certain things like citrus fruits, which I love. I love oranges. I have an orange tree in my backyard now, and I absolutely love it. I love oranges, grapefruit. I love the peel. I even eat the peel sometimes. It's so delicious. And no one's telling you not to eat acidic foods or to avoid acidic drinks like lemon water or carbonated lemon water. Some people are really extreme and they decide to just use a straw when they drink those things. In fact, the dentist I spoke to said, yes, could you ask people, please, if they're going to drink acidic drinks, to try and use a straw? But then I said, well, a lot of straws, they disrupt the environment. Most people aren't carrying around metal straws or, and what about the turtles, this kind of thing. And they said, well, okay, here's the real truth. The real truth is it's the amount of time that the mouth is exposed to that acid. So if they're going to drink it over the course of 5, 10, 15, maybe 20, 30 minutes. And then be done with it. Rinse out the mouth with a little bit of water and try and clear out that acidity. It's not about completely avoiding acid foods or sugary foods or acidic drinks. It's about, again, limiting the amount of time that the overall milieu of the mouth is acidic because of this whole remin thing, strep mutans, and the acid created by strep mutans that can erode the teeth. And the fact that if your mouth is kept acidic for long periods of time, you're going to provide the opportunity for faster and deeper development of those cavities. And keep this in mind, again, anytime we talk about demineralization, the formation of cavities, remember it's like a seesaw. It's either demin or remin, but not both. So anytime you're demineralizing your teeth, you're also not remineralizing your teeth. Okay, so really avoid alcohol, stimulants, smoking, vaping, sugar, mouth breathing, acidic foods, acidic drinks, but most of us can't avoid any sugars, any acidic foods. The other things can be avoided, but some of us are prescribed these drugs and need these drugs. Some people like a drink with alcohol in it every once in a while, and it's perfectly fine for them, or they've deemed it perfectly fine for them. In that case, try and rinse the mouth, try and keep the milieu of the mouth as moist and as basic, or alkaline rather, less acidic as possible.